As an emergency physician, I learned about the challenges of treating epistaxis patients in the ER and urgent care settings. So I designed NasaClip to help nosebleed patients get out the door quickly and conveniently. NasaClip is an OTC device that can be stocked up front in the triage room, so when a nosebleed patient arrives, they can be treated right away. It can be applied by a nurse, tech, or the patient themselves, and does not require a physician for application. We suggest that you have the patient first clear their nose of any blood clots by bending their head forward and forcefully blowing out of their nose into a basin, tissue, or gauze. You may then apply a topical vasoconstrictor, such as oxymetazoline, to the sponges if authorized by a medical doctor, and then insert the NasaClip device on a patient with an active nosebleed for 10 to 20 minutes. First, insert the nasal sponges with the curve pointing upwards. Then rotate the pinch pads over the nostrils and squeeze tightly shut. The patient should not be able to breathe any air. You may adjust the device for a snug fit as needed. You can ask the patient to keep track of the time on their cell phone. They can continue to wait in the waiting room or triage without taking up a valuable room and come back to the triage provider to check for bleeding after 10 to 20 minutes. A mask can be worn over the device if needed. Tell the patient they will get a take-home device once bleeding has stopped. This will ensure the patient will come back to be checked and doesn't elope before the encounter is closed. This way, the patient is happy with their rapid treatment, and the healthcare professionals are satisfied that they were able to successfully treat a patient in less time, possibly without even using a room, and minimizing the time a physician needs to spend with the patient while maintaining high clinical standards. If the patient is still bleeding, the NasaClip sponges can be rinsed with clean water, squeezed dry, and reinserted. If needed, more potent vasoconstrictive agents such as TXA may be added to the sponges. NasaClip helps to treat nosebleed patients quickly and effectively with fewer resources and helps to avoid the painful and invasive measures like cautery or nasal tamponade devices. Keep patients and your healthcare team happy with NasaClip. Pressure on the nosebleed and off you.